Good morning. I'm Dr. Howard Lux. AC separations. Common injuries, especially if you've fallen on your side or if you're a hockey player and you just smacked your shoulder into the boards and someone came in after you. Now you've noticed a little bump or perhaps a significant deformity on the top of your shoulder in the area where your collarbone or clavicle tends to meet the shoulder joint. An AC separation is distinctly different than a shoulder dislocation. A separation refers to the fact that you've separated the clavicle from the acromion, which is a part of the scapula sitting above the shoulder. In general, we grade AC separations starting with a type 1 all the way up to a type 5. The grade depends on the degree of separation and the direction that the clavicle has gone. The type 3 AC separation, where the ligaments are torn and there's an obvious deformity, is the most difficult one with regards to how we manage it. It turns out that there are stable and unstable forms of type 3 AC separations. That means that some of you have a type 3 AC separation and you go through a process where you let the joint heal and you feel fine and you can return to all your activities. But then some of you have an injury where that clavicle remains freely mobile. You feel it snapping, you feel it popping, the deformity changes its appearance as you move the shoulder. That is an unstable type 3 AC separation. So we used to think that all type 3 AC separations and above required surgery. That's not the case. Most people with AC separations do well without surgery. Type 4s where the clavicle has gone backwards through your trapezius muscle, those would benefit from surgery to remove it from the trapezius. The ones that are even higher degree of separation, such as a type 5, would generally benefit from an operation as well. But since the type 3s are most common, and that's likely the one that you have, you need to wait until the injury has resolved acutely, the swelling is gone and the pain is gone, but the deformity still exists. Now, is it stable or is it unstable? The only way to find out is to go ahead and try your activities and see how it feels. Again, unstable type 3 AC separations tend to benefit from surgery. Otherwise, you'll have a persistent degree of disability. Stable type 3 AC separations tend not to require surgery. That bump will be permanent, but you'll get used to it. Oftentimes, it's better to have a bump than a scar. Bye-bye.